Hello, everyone, and welcome to this session. My name is Milen Jacob, and I would like to have another wonderful day with you discussing OET Speaking. So if you are online, able to listen to me, watch me, please start sending something on the chat box so that I know you are there. And that would be wonderful. I'll just start in a moment while everyone logs in. Right. Yep. Just getting it ready for all of you. Yeah, I see Divya, yes. Selva, hi there. Pom Pom, Rose, hello, hello. So, Joanne, good morning, good afternoon, good evening, depending on where you are. Remil, Veda, excellent. Yes, good evening. Divya from India, Nimi, Binu, Heigel, Faisal, Yusuke, Jean, or Jean, Afia, Khalid. Let me know where you are from as well. Sarah, Shanti, Anumol, Rafaela, Sangeeta, Jobin, Lipsy, Amrita, Gunjan. Excellent. So, hello everyone. Thank you so much for having me and participating in this session. So, today it's going to be yet another day. Hi, Behanan, Rabin, Seema, hello, Amrita, Landra, from Pom Pom is from Spain, good. Divya is from Saudi Arabia, from India, a lot of you. Juan from Saudi Arabia, Emmanuel, Gunjan, Revati, hi, Joe, Anna from Philippines, Chuni, Subomo, Rabin. Yeah, hello Rabin, I'm from India as well. So Nadia, Tyra from the Philippines, yes, Lina, Subono, Faisal, Neetu, May Dublin from Philippines, okay, and Khaled from Yemen, Sylvia from UAE, Heidi from Saudi, Veda from the UK, Suborno from Bangladesh, Lipsy from India. Good, good. So a warm welcome to all of you. And let's get started. So this is a series on OET Speaking, and this is also taking on from the previous sessions. So today we are going to look at how you can elicit and explore the patient's perspective. Right. Good to see Jimmy from Myanmar. Again, Abdel from Saudi Arabia. Right. From Faisal from Dhaka. Great. And good to see all of you. I'm sorry if I missed some of your names, but let's get started. So, in clinical communication, a lot of candidates sometimes feel or share that the patient's perspective is rather a gray area, but it's very important. So let's see some data which has been published. So about 30 to 80% of patients' expectations are not met in routine primary care visits. So this is based on a study conducted. So patients may have some expectations. I'm not talking about major events or episodes, but when they come with some problems, they may not really be fully addressed. Sangeeta Kumar, good to see you as well. Nancy, hey Nancy, Ajin, Savan, right. So good evening, Rani. So don't forget to share your feed if your friends would also be interested in watching. So yeah. So one of the reasons for this is the inability of health professionals to understand patient's perspective, right? So how much do you really understand the patient's perspective? That is a question which has to be addressed. Right. So let's see how it's going to impact you. So understanding the patient's perspective is important for two things, and you love to hear those things. One is it is an important part of patient-centered care, but it will also improve your OET test score, especially in speaking. We are dealing with speaking. So both ways, it's going to be fantastic. Now, patients typically share their perspective on their own. So they may say, this is what I feel, etc. And that can come in the form of statements. They might state, this is my feeling about my condition or illness. But they may sometimes give you cues. So what I mean by cues is they may not explicitly tell you that this is what they think or feel. They might either use, let's say, nonverbal cues through their body language, or sometimes hesitate, and then they expect you to take on those cues and understand that they want to share their perspective with you. But if they don't do that, then you have to ask, explore, elicit. So the second arrow is pointing to that. They respond to health professionals' inquiries. So that's your inquiries. They respond to that. Right. So, yeah. Okay. So that is very important. Sorry for the distraction. I just have to check on the feed. And sometimes just checking if you are able to follow it. Excellent. So sometimes if you don't listen to them or elicit the concern that they are either sharing with you or they want to share with you, and you move forward to another part of, let's say, a history collection or something of that sort, what you're typically doing is you're redirecting. So health professionals often redirect patients' initial description of their concerns. So when they say something like, this is what I am going through or something of that sort, typically many health professionals might say, oh, all right, yeah, but let's see this first or something of that sort. So that's what redirecting is. You're taking the attention away from the concern or their perspective, whatever it is. And so that might cause more problems because those descriptions never get completed. All right. So it's left, undone or untouched. And then you have late arising concerns. So they might either share that much later or, might not even share that. And that leads to, a huge opportunity to gather important patient information is missed. So this is what happens when you actually don't pay attention to their perspective. Right. Thank you for all those who are sending stars. I really appreciate that. And I hope, I'll be able to give you fantastic lessons. Right. Excellent. So this is what happens when you redirect the attention or take the attention away from the perspective they are sharing. So that is criminal. It's incriminating. When you redirect, you're interrupting them. You're interrupting them. Stop. And it never gets completed. So to explain this, as always, I've got a patient, but today I've got the patient's carer as well. So Ken has survived a stroke and is about to start his rehabilitation, right? And we also have his partner, Ella, and she's also concerned about the recovery and the success of the rehab, right? So we are going to look at what it means by patient's perspective through their, narrative, through their story, through, what the health professional over there. She could be a nurse, she could be a doctor, she could be a physiotherapist, doesn't matter. She is a health professional and she is representing you, all of you, right here. So whatever you sometimes do or say or fail to do in a clinical setting and also in the OET's speaking context is what I'm going to illustrate with the help of this example. And then you will have something to do on your own after observing this example. And we'll also come to an OET's speaking roll card towards the end of today's session, right? So Ken has his perspective, right? If you look at him, he's feeling glum after having survived the stroke. And in the picture, you see Ella, the partner, discussing something with the health professional. Sorry, so both of them have got their own perspectives. And Ella's perspective has a name. Often it's called caregiver burden. So a patient's caregiver might have, their own concerns, and on top of it, they have to take care of their loved ones. So that's going to be kind of a double problem. So that's what's called the caregiver burden, right? So we're going to address that. And in OET's speaking context also, you always, you might get, not always, it could be like you're talking to a patient, but you see role play cards where you're also talking to the carer. So it's important that you know how to deal both. So this is an example of Ken's perspective, right? So his idea, patient's ideas are part of the perspective. So he says, I have no clue about rehab. So he has absolutely no idea about what a rehabilitation program is. Feelings, that's another part of perspective. So he feels it's awful. Have always been able to walk on my own. So, he feels very down. Right. Thoughts, that's also a part of one's perspective. So what's he thinking? He's thinking, I think she will walk me a few steps, right? So that's his thought, right? And concerns, that's an integral and important part of the patient's perspective. Concern. So now his concern is, will it hurt? Will it be painful? And effects on life, how is it going to impact his life? He can't work anymore in the farm. So we assume he is a farmer, right? And he's worried about how he's gonna manage his farm. So let's see their conversation. So the health professional says, hi Ken, we are going to start the rehab. Are you ready? He says, I feel awful. Now, she says, I'm sure you will feel better once we get started. All right. So what's happening here is the health professional is not addressing or eliciting further on the perspective of his feeling awful. And so she just says, that will be fine, you'll be okay, don't worry about that. Just like many of you sometimes do in when you are practicing, right? So he says, okay. See, if you look at those boxes, look at the color, right? I have highlighted, or in bright color you see the perspective which has been addressed, but in gray boxes you see all those perspectives which have not been touched by the health professional. Do you think that could be a problem? Let me know in the chat box if you think that skipping all those perspectives is a problem. We're going to see what the problem is. Yeah. So you agree with me that it is a problem. Good to see you, Gigi, Aslam, right? Yeah. So as you can see on the screen, the problem is that she failed to elicit the patient's perspective, and it leads to an absence of patient-centered communication. Whether it's OET speaking or healthcare expectations in most developed countries in the English-speaking world, it revolves around patient-centered care. So that's compromised. And for OET candidates, it might affect your OET score in clinical communication part of the assessment criteria. So that is also a problem. I think for many of you preparing for OET, that is a bigger problem than patient-centered care. But when I do a session, I just don't want to focus just on OET speaking or OET test preparation. In fact, that's what OET wants as well. OET wants you to be work ready for working in the countries where you want to work. So remember, when you prepare for OET, it's not an end in itself. It is something which is going to help you throughout your career. So always value that in that sense, right? So good. Now I want, right, so now I'm going to show you how it could have been done better. Now this is just an example. There are different ways of doing it. Now she doesn't say it's okay, let's get started. She says, I can imagine that. Can you tell me specifically what makes you feel so? All right, so the perspective is being further explored. Then he says, my future looks bleak. Now she says, that's the whole point of the rehab. I'll touch on that later. Is there anything else? Is there anything else? So now the reason why she doesn't address that is that post-rehabilitation, he wouldn't be sharing that concern, right? Now he brings in his concern. Will it be painful? Will it hurt? Right? Now she says, I'll keep checking on your pain and stop if it hurts. And he says that would be great. So he feels much better because the health professional, the health provider, has in fact tried to understand the perspective of the patient a bit more. Now, I'm not saying that you will have to explore everything, all right? You may not have to ask a lot of questions, but typically it's absolutely fine to ask them if they have anything else to share, so that the some of the concerns or thoughts which they haven't shared might be shared at that point of time. Right, so everyone get ready to do the next part. I've given an example. Now it's time for you to practice, to share your examples on the chat box. I hope you're ready. Now, we were looking at the conversation between the health professional and Ken. Now you are going to tell me what all could the health professional and Ella be talking about, right? So let's look at Ella's perspectives one by one, or different aspects of her perspectives. So right here on the screen, you have her feelings. Now type in what you would ask her to address her, to elicit her perspective. Doesn't have to be perfect. Just keep your comments coming. That's absolutely fine. Right. And John says, can you tell me how you're coping in taking care of Ken? Sangeeta, what makes you bother? How may I help you? Right. Right. Yes, Gigi. Hello, Elsa. You feel a bit worried. How can I help you? Good. Okay. I'm sorry to hear that. Could you tell me more about that? I appreciate your feeling. If I were you, I would react like this. Could you elaborate more on that so that I can address it? Excellent. Oh, sorry to hear that. Could you explain me detail? How can I help you? You will be fine, right? Okay, so I've got some great answers. Cool. So let's move a little bit further. And so now you have the feelings and ideas on the screen. Let your thoughts, let your comments just flow. It's absolutely fine. Because the more you try, you'll get better at it. All right, don't worry. Since you're with us, we will do everything to make you feel better. Sorry about that. What are you feeling? It must be very difficult for you. Good. I'm really sorry to hear that. I can understand how difficult it must be. Yes, Anutijo, good. I'm sorry to hear that. Is there any way I can help you feel better? I know this might be inconvenient and stressful if in your part as a carer, however, it's imperative that you have to take care of yourself too. Yep. You're going to see more of that. I understand your concern. I'll help you with it. Right? Yeah. And I'm going to give you more of her perspective. So, I want you to type in response to the latest aspect of her perspective. A little bit more. I'm really sorry to hear that. May I know the reason behind it, Lena? Yes. Nitu says, I'm sorry to hear that. I can understand your concern. Don't worry about Ken. We are here to help you. He is in safe hands. Neither it's good, but if you can try to avoid too much of, I can understand your concern. I'd rather prefer that. And I think I've said this many times, so I don't want to sound very cliche, but it could be like a cliche. It must be distressing. I'll help you in this regard. I see that it's bit difficult. Could you tell me how you're feeling so we can address it? I totally understand your concerns. Can you please elaborate it more for my better understanding? Bhimalinga says, I can see you that you are tired, but this feeling is quite for people who requires it. However, I can help you with it. Now, you see that, from the concern, you understand that she herself has her own health issues, which sometimes, get laid on the back burner. So often that's part of the caregiver concern as well. Their own health issues may not be well addressed. Now you have the effects on life as well. So she feels that she may have to resign from her job and take over Ken's farm. So all these things are really, really worrying. Madam says, I'm sorry you feel that way. Could you please tell me more about it? Right. Yes. And yet more of the perspective, expectations. Will he regain his health? So that's a major problem as well. So, yeah. I'm really torn between talking to you and reading all your comments. So, you look upset. What is bothering you? Yes, Binu. Thank you, Jisha. I'm sorry you feel that way. Could you please tell me more about it? Right. So we will closely monitor you, and you wouldn't require to be tense anymore. I'm sorry to hear that you have to give up your work, but on the other hand, you will have more time in taking care of the farm and can also. I would rather tell something of that sort because might be slightly judgmental. Slightly, yeah. So make sure you're even when you are trying to reassure, do not be judgmental. But it's a good reply as well. Let's try our best for his recovery. Okay. Yeah. So I also want to know if the techniques which you can use to elicit and understand the patient's perspective are a little bit clearer to you? Is this one area which you have not really paid much attention? Let me know your thoughts. Now, the reason I'm asking you to do that is I've heard from a lot of candidates preparing for OET that this is not very clear. They're not used to it. They have little idea about how to do that. So that's one area where you'll have to really improve. Now, in a while, we'll be doing an OET role play card. Again, I'll give you an opportunity to further explore the process of exploring the patient's perspective and eliciting all of that. So let me know how much right. Okay. Yes, Kantaraj, yes, thank you. I knew that. So that's why I was asking. So now, whenever you have, a scope to explore your patient's perspective, try to think of it and act accordingly. So that's going to be really, really helpful for you, I suppose. Right. So now I've got some useful phrases which you can probably use to elicit the patient's perspective, some questions and phrases for you to use. I want you to also let me know in what context you might use them. Can you imagine setting scenarios when you would be using it? So you can ask questions like, what do you think is wrong? What do you think has caused the problem? What are you afraid this might be? Tell me more about your pain, whatever. Tell me what the pain was like. So just a few random questions and phrases which would help you in the process. Right. You can also use these. What have you done to relieve the problem? Have you tried any treatments? Have you seen other healthcare professionals? Is there something else that you did for this or did for the pain? Think of situations when you can use these questions or phrases. Right. What do you think would help you? What do you think would help you? How can I help you with this? What do you think about what I have recommended? Do you think it will help? What problems do you see in doing it? So again, in different settings, in different contexts, you will be able to use all these questions. Who will help you make a decision? So sometimes patients may not be able to make a decision on their own. They might need to consult with someone. Right. Do you want me to talk with those people, the people who could make the decision? Is there something else that is bothering you? Really a useful question. Is there something else that's bothering you? It seems you have something to tell me. If the patient is giving you a cue, you can, state that looks like you want to tell me something. Particularly, if you have, like what we discussed in the last session, sensitive areas, embarrassing situations, they might not really share their perspective. So you will be able to say something like that to elicit, to make them respond and share their perspective. Great. Is there anything else that you'd like to talk about? What else are you concerned about? All these phrases, questions will be really helpful for you. Now, shortly, we are going to do a role play and apply these skills. So if you have mastered some of the skills required to elicit the patient's perspective, understand that, then this would be a great opportunity for you. In the meantime, if you require assistance from IRS Group, please go to irslearning.com, or in the App Store, you can download an app. And we have specifically designed courses for candidates from different parts of the world. So we have just launched a special batch for Middle East candidates. So all those who are from Middle East countries will be able to benefit from that. And we also have tailor-made training sessions for all time zones, actually. So that's going to be great. You will get a one-on-one trainer who will train you specifically for those areas where you want to improve, or after assessing you, will give you an entire OET preparation. Great. So let's come to the role play card. Now, this is one part where I want you to excel in what you're going to do and apply all these things. So get ready to type. And what you see is this is a nurse's role play card, but anyone can try that, whether you're a nurse or a doctor or a pharmacist or a physiotherapist. It doesn't matter. The skills are the same. And in the OET's context, the eliciting and understanding the patient's perspective is same across the board, so you don't have to worry about this being a nurse's card. It's absolutely fine. So the setting is a surgeon's clinic, and a patient with a body weight of 170 kilograms who is scheduled for a bariatric surgery has come for the pre-op consultation. The patient is anxious about starting this special diet and possible complications. Now, you just say 3 of the bullets. Find out how she feels about the surgery. Explain that the very low energy diet includes meal replacement products and is easy to follow. Reassure the patient that the results from the screening test have been evaluated and the chances of complications are negligible, and that all precautions will be taken. Right. So let me know which is the area where you're going to try and apply the skills of eliciting and understanding the patient's perspective. Which of the 3 bullets will need that more? Let me know in the chat box. Is it the first bullet, the second, or the third, where you're going to probe into the patient's perspective? It's very simple. Just type in the number. So most of you feel that it's the first bullet, which is actually true. So that's one area where you can explore the perspective a little bit more. So I want you to type in the questions you will ask in order to understand and elicit the perspective of this patient. Yeah, most of you got it right. So let the questions come. Agent says, can you share to me how do you feel about your incoming surgery? Maybe upcoming surgery? Yeah. Can you share with me how you feel about, right? But I want you to remember one thing. The bullet says find out, right? How she feels about the surgery. But that doesn't mean that, it's kind of a one word question. You just ask, how do you feel about the surgery? And they say, this is what I feel, then you move to the next bullet. And that is the big, concern that I have about you skipping. Remember what we discussed at the beginning about redirecting or, interrupting. So that should be avoided in this context. So a little bit of probing into the patient's perspective is what I'm asking you to do. We can say you seem to be very anxious. May I know what's bothering you? Yeah. Can you explain to me what makes you bother to start the special diet? Yeah, that's about the next bullet, I suppose. Can you tell me how are you feeling right now? Could you please tell me what you know about the surgery, Lijo? Very good. I can see that you're quite anxious about the surgery. Would you like to know anything more about the surgery, right? Have you heard of this bariatric surgery before? I generate, yes. I think that question is out of place because it says the patient is already scheduled for a bariatric surgery and has come for the pre-operative consultation. So that means you are, off the task when you ask, like, do you know what bariatric surgery is? Because at this stage, the patient definitely knows about the surgery. May I know how do you feel about your upcoming surgery? You seem to be a bit worried. How can I help you with it? Could you tell me, please, about how you feel about the surgery? Hi, Naveen Babu from the UK. Good to see you. I do feel that you are a bit concerned about your surgery. Is that right? Could you please tell me what concerns you the most? It's perfectly normal to show anxiety towards surgery, but do not worry. We have experienced doctors and advanced instruments to put you in ease. I'm okay with it, but again, Kantaraj, remember that might not console them as much as you think it would. So the technical aspects, yes, but we are focusing on the how do I put it? Not on the biomedical perspective, but rather on the clinical, psychosocial aspect of communication, which is required at this in this context, particularly. How do you find your upcoming surgery? Well, I don't really get it. If you don't mind, what is bothering you? You will be perfectly all right. That is again, reverting. When you say, don't worry, it's all right, you are rebutting their concerns, so that should be avoided. May I know how you feel about the surgery? Right. You look anxious. Would you mind telling me what your fears are? Very good. How are you feeling about your scheduled surgery, right? If I'm sure you're anxious about the surgery, would you mind please telling me what is bothering you? Yes, Jocelyn? You seem a bit anxious. Would you mind telling me more about your concern? Yeah. How do you find your upcoming surgery? I don't really get it. Like, ask a little bit more specifically into it. Right. Can you please tell me more about it? Yes, good, Gigi. I believe that you have an upcoming surgery. Can you tell me more about how you feel it? It's good, yes, Christine, but you are specifically doing a pre-op consultation, so you don't have to say like you believe that you have a surgery. Try to avoid that, but otherwise it's good. You look anxious. Would you mind to tell me what's bothering you? Yes, Nida, you can ask that. You look anxious. Would you mind telling me? Not mind to telling me, but mind telling me what's bothering you. Good. Hey, my name is Madhu. I'm one of the nurses who's working here. You're ready for a surgery tomorrow. Is there any fact that you know about the surgery? Okay. I've got just a few things to share with you, Madhu. We don't know if it is tomorrow. Just says it doesn't mention when the surgery is. We just know it's scheduled. That doesn't mean it's tomorrow. And typically, when you have a pre-op for a bariatric surgery, it could be a few weeks before the surgery, actually, because you hear the discussion about a very low energy diet, which means the patient is getting started on that. So they will require more time for that. So remember that, yes. And I can see you're feeling anxious about the surgery. Do you mind telling me your concerns? Yeah, Christy. Would you want to know about the surgery? Okay. I would prefer addressing the area of concern rather than giving a lot of factual information. You look so anxious. Could you please tell me about your concerns? Amita, yes. Murli, thank you very much. Rani says, I've got your notes, but I'd be better if you could tell me in your own words regarding your upcoming surgery, as you seem to be anxious. Very good. Excellent. And I think you have taken a leave of listening party, but it's pretty well done job and smart work. I really appreciate that. You look a bit anxious, so could you please tell me what is bothering you? Yes, Bindu. You look anxious. Could you please tell me in your own words what's bothering you? Even better, Kantaraj, right? Thank you, Anna. Anu says, could you please share how we are feeling about the upcoming surgery? Do you any other concern? Do you have any other concern regarding it? Good. Neetu says, you're worried. Could you please tell me what bothers you? Yeah. What makes you anxious about the bariatric surgery? Tell me more about it, Robin. Yes, good. Giselle says, I can see you are a bit worried about your upcoming surgery. Could you tell me more about it? Yeah, you seem worried about your surgery. Can you tell me about it? Yes, yes, yes. So that's a good way of, starting it. And the patient would be sharing some of their, concern or idea or thought or whatever their perspective is. So It could be about the diet, which is going to be discussed in the next bullet. So there would be some concern shared about that. It could be about, closer to a surgery, and you see that he or she could be overweight, and then, having to go through a special diet, that could be a worry. They could be worried about what they have read, somebody told them something, and all those could be potential as areas of concern. So what I want you as OET candidates preparing for your OET test is not jump that bullet, right? I'm not telling you should spend a lot of time and then end up not being able to do the rest of the role play. That's not the idea. But the trap, the pitfall is that sometimes, or oftentimes, a lot of candidates run out of what they have to say or speak pretty soon. So that could be avoided if you kind of take some time to really explore the patient's perspective. That should be fantastic. For instance, the patient says, I know that the surgery is going to be okay, it's going to be all right, but I'm really concerned about infections after the surgery. All right. I know that I have to start on this special diet, the very low energy diet, but I don't think I can do that. I'm used to, eating a lot of food, and then now having to stop that for 4 weeks or 3 weeks. I don't think I can do that. And then what would you say? You're not supposed to tell the patient, no, you have to do that. This is how you have to do it. You have to probe into that concern, that thought which the patient has just shared. So you can ask a lot of things like, well, can you tell me specifically what part of this diet is your concern? Is it that you might feel low on energy? This is still providing you with the sufficient energy levels for you to continue your activities. Is it the quantity of food that's bothering you, or having to skip your favorite meal? Imagine the patient says, I've always had dessert after my lunch or dinner, right? What will you say? Dessert, and at this time you can't be rude. You need to probe. Why do you think you will not be able to skip the dessert? And do you think that there are some meal replacement which is sweet? So so this is what it is all about, trying to be on the same page with your patient and with your interlocutor in the OET's context. And that bridges the gap that every thought, parts of their unshared concerns, everything has to be shared, and it's your duty, your task to probe on those specific areas, so that how do you feel about your upcoming surgery? Is there anything else you would like to talk about? You look anxious. Could you please tell me what concerns you? Need to Khalid, yes. Thank you, Bindu, yes. So, yeah, that's what I was telling about. It's your task to ensure that, they really share their perspective. So before we sum up, let's just recap. These are really important for you. So, Amna says, what if I don't know more information about the surgery? In the OET's context, you don't have to worry. Everything that you should know about the surgery will be given in the role play cards. So, for instance, from the background, it's a bariatric surgery. And imagine you have no clue what a bariatric surgery is. But again, the body weight of 170 kilogram, that might give you a clue. The special diet, very low energy diets. So you can just kind of even, fill in the dots, and it doesn't really matter. Your knowledge is not assessed, so you don't have to worry about, knowing the specific information. Any information that you might require will be there for you. So Amna, don't be bothered about technical aspects of the consultation. What is important is your communication. You interact with your interlocutor, who is your patient, right? And Arvind says, you seem to be a little bit worried. Can you please tell me what is bothering you right now? Devin, good afternoon. Right. So this is really, really important. So when you attend the test, when you're practicing, remember that a single bullet like this, find out how he or she feels, or explore the patient's concerns. It's not something to be completed in a single question. And also remember that if the patient is giving you or you are asking a closed question, and it's a yes or no response, that means the entire perspective is not being explored. So that is a clue for you to kind of ask a few more questions so that they share something. You don't have to force them to. If they don't have any other perspective to share, you don't have to tell them like, no, I was told that, you should share all your thoughts and ideas and concerns and expectations and all of those things which are part of the patient's perspective. You really don't have to do that, right? So be natural. That's very important in the OET speaking. You don't have to, kind of remember that, okay, I should spend so much time, I should be asking these many questions, or things like that. That's not Manuel. Thank you very much. Amna says, can you please save this video? Yes, this video will be available on OET's Facebook page. It will be recorded, so you can view that later. It will also be available on IRS Group's Facebook page. And yeah, so all those previous recordings are there for you to watch and revise. And if you are watching it for the first time, all the OET All Stars videos are recorded and available on the various social media platforms of OET and also IRS Group. So you can watch from those. You can use this candidate card to prepare to practice with your friends or anyone who is helping you with your preparation. So if you've got any other questions, I'd be happy to answer those questions as well about your OET preparation. And the focus today has been, again, clinical communication, particularly understanding and incorporating the patient's perspective. Let me know if you have any other questions. I'd be happy to answer them. You're welcome, Khalid. I hope all of you have taken some valuable insights on OET speaking as well as clinical communication in general. You're welcome, Neetu. Ronnie is asking how to reveal bad news. Yes. It's a little bit nuanced because, Ronnie, you will have to kind of find out if the patient is ready for the bad news you're going to share. You have to prepare them. And it depends on, the context as well, but it's a fine line. You have to balance between being honest and being truthful. For example, somebody has a terminal condition. You can't just say like, you'll be fine. No, that's not appropriate. At the same time, you can't just go and be blunt with them. So if you watch my previous session, which was aired 2 weeks ago, about handling sensitive issues. This has been addressed in a little bit detail, so can you please go and watch that? I don't have too much time for that, but I'll definitely include that in upcoming sessions. You're welcome, Bimalinka. Arvin, angry and agitated. Arvin, yes. So again, when somebody is angry, use your clinical communication skills to de-escalate or to reduce their anger. That's what OET is assessing, you. And they won't be, perennially angry. Their anger levels will come down if you ask them questions, reassure them. So when you hear about agitated or angry patients, it is your opportunity to use your language skill, your clinical communication skills, and get better scores as well. So be happy when you have a little bit, difficult situations. Yes, May, thank you very much. Manuel, yes, you're welcome. Linking words while speaking. Manita, I wouldn't speak, thinking about linking words. But if it just flows in naturally, use it. You don't have to, when you go to the test, you don't have to think like I'm going to take a handful of linking words and use it in your, speaking or writing. No, that's not the way it is. Be natural. If it's required to connect, yes, you may use it. But when you use too much of linking words, especially in speaking, it might sound very, fake. So it's not too important, actually. You're welcome, Amna. Bonifacia, yes. Sangeeta, yeah, non-convinced patients. Again, use some of your skills, your ability. I know you're brilliant, so use those skills to convince them. But you don't have to force them. When you explore their perspective, you will be able to kind of, address those areas and, go back to the beginning of the session today. So use some of those skills. Uncooperative, angry patient. No, medical knowledge is not assessed. Thank you, Ajion. Yes, good luck for the test. All those who are preparing for the test, good luck for your test. Yes, Rani. Yes, Bimalinga, it's not about the clinical experience or knowledge. Information, it depends on the bullet points. If you're asked to explain something, you will have some clues to that, use it. But that's it. You're welcome, Sangeeta. Yes, Christy, you're welcome. So thank you very much, everyone. Neetu, Manita. Thank you very much, everyone, and stay safe. And our appreciation from IRS Group for all the hard work all healthcare professionals around the world are doing right now. And so OET has, given All Stars, premium preparation providers like IRS Group and other premium preparation providers from across the globe to help you in your preparation. So thank you very much and have a great time. I'll see you soon with the next session. So thank you, everyone, and stay safe.